Good afternoon. My name is Luzina Brown, and I will be presenting on tobacco prevention and control programs, which is an evidence-based program called Not on Tobacco. Introduction. Tobacco is the actual leading cause of death in the United States and has become the nation's most significant public health issue, causing major diseases and numbers of deaths. According to studies, it accounts for 30% of all cancer deaths and 21% of cardiovascular disease deaths. The purpose of this research is to highlight behavioral patterns and health determinants that influence teens to smoke and to discuss a successful smoking cessation program, specifically for teens and active smokers as well. Not on Tobacco is a smoking cessation program that was developed to study smoking quit rates in teens from various high schools. Most adult smokers started smoking from adolescence, for which this focus for which the focus is on teenagers providing intervention to quit smoking. The target population for this evidence-based program is teenagers ages 14 to 19 years. This program was founded by the West Virginia University Center for Public Health Research and Training along with their partners including the American Lung Association. NOT goals is to promote cessation and reduce tobacco use among teens. It also wants to become a recognizable and most effective cessation program for teen smokers. To establish an effective quit smoking program specifically for teenagers. Summary, not summary. Now consists of 10-15 minutes gender-specific sessions led by trained facilitators. It's held in schools during regular school hours. Sessions are small groups of 10 to 12 teenagers. It is expressed in a teen-friendly language. Teens participants are current smokers who smoke 2 to 3 packs on weekdays and even more packs on weekends. Significantly decreased smoking and increased smoking cessation among teenagers. Packaged and successfully disseminated to schools and community organizations. It's proven sustainable and useful in a variety of settings. Determinants of health or social factor. Social factors. Tobacco use is learned and it is socially meditated, mediated and an addictive behavior. Peers serve as a support system and helps reduce stress in teens, but it can also be a distraction and pressure on teens who try to stand out and be different. They become bullied and to blend in with a social group that is led to unhealthy behavioral choices, including the use of tobacco. Social support has been proven to be significant in determining an individual's health, and with such support, teens would want to quit and be a part of smoking cessation programs. Families. We learn a lot from our families. Our lifestyle choices are also influenced by them, which includes smoking cigarettes. If an entire family or part of a family smokes and embraces smoking, it shows to teens that smoking is acceptable, making it difficult for teens to want to be a part of a smoking cessation program. But families can also be a pillar of support and encouragement. Self-image. It's always important for a teen to have a self-love and to make choices that affect him or herself. Self-efficacy can also promote self-image because it is the sense of having control over one's life. This can make a person want to quit, and lack of it will make a person not want to quit. Social economic status, which is the most important predictor of health, can affect smoking cessation program because of that. It includes income, education, place of residence or community, and occupational status. Youth that are from parents with low income tend to start smoking at an early age and they lack the educational resources in their schools to prevent smoking. People of low income turn to smoking to alleviate stress and boredom that will affect smoke cessation programs. Societal norms. The society views smoking as a recreational drug until a person is hooked on it and become addicted to the nicotine. Tobacco is attractive to youth because of the social association they learn between tobacco news and the kind of social identities they wish to portray. Tobacco news is reinforced by everyday images and messages that youth encountered in society telling them what to do. NAD participants are very diverse. Teenagers are most susceptible to high risk behavior, and also being pressured by teens can lead to smoking. Being that participants are diverse, the NAD program is teenage language friendly. NAD is also considering parents' economic status. NAD in public health. There are more smoking-related deaths in the United States. Studies have shown that majority of adult smokers started smoking in their teenage years. This is all in the effort to minimize smoking-related deaths in communities. Infrastructure. West are not key players. West Virginia Prevention Research Center plays a major role in starting a research study for teen smokers in Virginia. West Virginia leading the pack of teenage smokers with 42% admitting that they do smoke. A decision to step in and create a smoking cessation program that both worked and appealed to teens was made. They developed this program by working along with the American Lung Association. The American Lung Association has also adopted this program as the national best practice model. It advocates for policies, laws, and funding so that all tobacco users can have access to evidence-based treatment that can help them quit like NAD. ALA is also a leader in the area of tobacco cessation policy at the federal, state, and local levels. NHI, which is National Health Institute, funds research on tobacco cessation, supportive role by promoting the expansion of this program. All of these organizations work together by being supportive, providing all resources, financially training, and providing materials that were needed and through promoting this program. Key players, Center of Disease and Control provide financial assistance. Teenagers serve as participants. The Bureau of Public Health serve as evaluators. This program brought together different public health professionals such as the American Public Health Association, scientists, Jerry Dino, clinicians, teachers, and facilitators and trainers. External stakeholders. Stakeholders in this case are groups of organizations and individuals who are concerned with the effectiveness of the program. On the other hand, external stakeholders want to see the program succeed but are not directly affected if it is not successful. Organizations involved with this program are all after the same result or are interested in a smoking cessation program that can help minimize lung cancer and every other smoking related deaths. Members of the communities know that the community knows what members of the community, members of the communities know what the community needs and what will work. Their inputs are valuable assets. Public schools facilities were used as implementation groups for this program, and West Virginia University is a research university that was made available to this study. Schools were used as research centers. Programs were implemented in schools with students, parents, and teachers. Parents need to give their consent even though the kids had to be willing to quit, and having that willpower makes the maintenance part of this program much easier. The ALA has facilitators training workshops to ensure implementation fidelity. This interactive training provides a foundation for understanding the NAD program's core curriculum and how to deliver it effectively. Facilitators are trained to carry out sessions that was created to help kids quit smoking. Facilitators also guide teens through each section, utilizing a total health approach that focuses on healthy behavior, stress management, and life skills. Funding. The CDC also funds research on tobacco cessation along with the National Institute of Health. The American Lung Association supports funding for tobacco cessation and prevention work through the prevention, and public health fund. It also supports adequate level of funding for the federal agencies that work in tobacco control and prevention. The ARA supports funding for federal, states, and local programs that help those who want to quit and to prevent the use of tobacco. The Department of Education has to approve the sessions that are carried out during school hours and on the school property. Politics and ethics. Ethical concerns. Obtaining parental consent, active and passive consent. Parental consent is essential to a youth research program because parents are concerned about their kids being active smokers and knowing what and wanting to know what the research entails. Is it beneficial for the kids or will it harm their kids? Secondly, some parents might be in denial that their kids don't smoke and are just being kids and won't need to participate in a cessation program. It is right to obtain parental consent for a minor, but also it becomes an obstacle to the effectiveness of the program. There are two kinds of consent, a passive and an active parent consent. Parents are required to reach out to facilitators if they do not want their kids to participate in research with a passive consent. That eliminates the need for a written consent. With an active consent, parents are required to sign a written consent form before their kids can participate in research. This kind of consent can minimize the number of participants who don't want their parents knowing that they are active smokers. There's also a concern for youth privacy to be respected during research, which can serve as an important consideration for recruitment of participants. There are mandatory reporting that could lower a program effectiveness of a program that could lower a program effectiveness, especially if it's around money. Some program uses money in exchange for participants, but certain considerations are put in place for youths with monetary incentives to protect their privacy and avoid them using the money for cigarettes or other illegal drugs. Not opponents, tobacco industry and parents. Tobacco industry are considered opponents because if teens quit smoking, tobacco sales decreases and it becomes bad for their businesses. Tobacco industry fight against policies that are in favor of high tobacco pricing and age increase in order to purchase tobacco products. Tobacco industry also have considerable amount being paid in taxes, which one way or the other influence the economy. That means they do have a voice. Having a voice means that policies concerning their products becomes an obstacle that they need to address. Some parents are against their children or child participating in research programs and will also refuse to sign consent forms that is needed in order to have participants for this program. Factors contributing to the need of the program. Social factors, rise in teen smokers, public health concern, increasing health lifestyles, media. Teen smokers has greatly risen and most of the 45 million adult smokers in the United States started smoking during their adolescent years. Teen smokers has become a public health concern and cessation program is a major way to address that issue. Due to major smoking health-related problems, there's a rise in health insurance, making it difficult for low-income citizens to obtain health insurance. The government is spending billions of dollars on health care due to the many illnesses and diseases that are deadly and costly to treat for patients that have Medicaid or other governmental funding. It's important to include lifestyle because in a way a person's life speaks of their background and interest and level of income. With that said, it is important that not include a lifestyle in their curriculum. The media also have ads fueled to this fire by promoting the use of cigarettes, which has a greater influence on tobacco consumption. Tobacco industry are using the media to influence teen smokers even though prices are increased on tobacco products that still don't prevent kids from purchasing cigarettes. This industry also has a long history of providing job opportunities which influence the perception of the community, mostly for minorities. Factors affecting the way NAD was developed or marketed. Social factors, economic factor, and political factor. Because youth are greatly influenced by their peers and family, This program offers classes such as self-esteem, self-reward, and relapse intervention that can help youth cope with their word out of their sessions. Studies have shown that people with low income tend to smoke more and suffer more from smoking related diseases such as cardiac disease, respiratory illnesses, and lung cancer. West Virginia had a high rise in teen smokers in schools that were selected for this program, allocated within a low income communities. The program provided sessions that were beyond the individual and touched base with the youth surroundings, the families, and communities. Tobacco control program can provide the education to the public that such services such as not on tobacco is available, thereby creating finances so that it can become available on a wider scale. Association with American Lung Association also created a platform to be well recognized as a program and for widespread diffusion. Because of its many success, this program has become national and has many supporters such as CDC and NIH. After the ban placed on tobacco broadcasting in 1971, a group of African Americans from newspaper publishing company requested that the tobacco industry increase business with them. Delivery, marketing plans. To market a smoking cessation program, there are a few things that need to be addressed and followed to accomplish that. Knowing a program means that as a developer, the qualities, the limits of the program and its purpose are understood. Secondly, the target population is the main focus because they are the population that your program appeals to. It's important to find sponsors or organizations that have interest in such programs and get them to invest. The media plays a major role in any publicity. It can get the message across about the program and deliver information about it to a larger group of people than just the target population. The newspaper is another form of promoting a program to the target population in this case. Social media will do a better job at marketing a program because it targets teen smokers. The teens are most advanced with social media and can get the message faster through this medium. School bulletin board is another means because announcements and important information are posted there for students. Since schools will be using their facilities, it is a good way to promote their program. Students talk all the time. Even though word of mouth is not the most trusted way to transfer information, there's a guarantee that anyone else who missed the information from any of that medium can hear it through a friend or someone. Schools are an important player in marketing this program because they are resourceful and plays a major part in the implementation of the program. Marketing strategies. Social marketing can be used to complement the theoretical framework at the institutional and the individual level. Conveying the right information. Statistics will cover a number of teen smokers that has greatly increased, the health problems that are associated with smoking, and that there are more disadvantages of smoking than there are advantages. It's also important to let real people who are living with lung cancer and those that started smoking from their teenage days tell the stories because people can better relate to real life tragedy. Conclusion. Conclusion. NIDA has become successful over the years because of its content focus and its implementation. It focuses on teen smokers attacking the root of a smoking problem that is taking away many lives and creating long-term illnesses. NIDA also worked in appeal to teenagers. Short-term effects of this program are to help teens quit smoking through sections that provides the education, stress management, and self-esteem classes to build their confidence to make them want to quit. A long-term effect is maintenance and preventing relapse. Maintenance is long-term because it focuses on life after quitting, what to do to battle the urges and what can replace that habit. Resources and materials are provided to these kids to help maintain their behavior change. Smoking is something that is mainly associated with socializing and having fun. Some people are noted to use that as a way to forget their problems or as a stress diffuser. People benefit from that and it also provides warmth during the cold weather. Tobacco is used for medicinal purposes to assist with pain and so forth. With that said, tobacco has more negative side effects, like respiratory illnesses, like respiratory illnesses. It also creates an addiction to the nicotine that makes it difficult to quit. Some of these side effects are withdrawal symptoms, vomiting, profuse sweating, pain, irritability, increased appetite, and more making life increased appetite and more making life unbearable. NOT is offering assistance with that to provide a good quality of life. Thank you all for joining me today. This is the end of my presentation.